Hi, I'm Dr. Brian Humphreys. We're talking today about food allergies. Food allergies are obviously things in our diet that we are reacting to. Not everything, however, is an allergy. Occasionally, we don't have any immunoglobulin E involved. Remember, in order to be diagnosed as an allergy, IgE should be the causative agent. When we find no evidence of IgE, we cannot call this a food allergy, and instead, we call it a food sensitivity. As my mother used to say when I was little, this food doesn't agree with you. Testing can be done, both skin testing and blood testing, to look for the IgEs that a person has in their bloodstream. If IgE is indeed present, a real allergy to that food exists. Again, there are three ways to treat these food allergies. There's avoidance, medications, and immune shots. Most physicians strictly adhere to the first recommendation when dealing with food allergies. If you are allergic to crab, don't eat it. However, if there are very mild allergies that do not cause a fainting reaction or don't cause you to pass out or have an anaphylaxis reaction, sometimes those sensitivities can be modified. Occasionally, we'll recommend a rotation diet. The reason we develop allergies and sensitivities is repetitive eating of the same foods. Because of that, the offending food may actually be something that you like. Salad, for example, or tomatoes in the salad. Because you eat it every day, you have repeated exposure and slowly develop the reaction. A rotation diet will therefore avoid daily repetitive exposure. Every 4 to 5 days, that food is re-ingested. This plays tricks with the immune system, and even though you're still eating the thing that you like, you're not getting a full load of it on a daily basis. Slowly, the symptoms begin to improve. Usually during the first phases of a rotation diet, your offending foods, whether you're allergic or whether you're sensitive, are simply not ingested. This rotation diet will last for about 4 months. After that 4-month period, toxins that are in the bloodstream have been eliminated, and slowly but surely, new foods that you may be sensitive to can be reintroduced on a very cautionary basis. Before this is tried, however, please get direction from your physician. The rotation diet will be specifically planned for you. It will involve suggestions of things that you should eat and things that you should avoid. Sometimes our most favorite foods are eliminated from that diet. But other favorite foods, perhaps that you have not ever eaten, will be reintroduced. When that occurs, you will be avoiding all the offending agents that you're taking into your body and not even knowing it. The rotation diet is planned specifically for your pattern of allergies. A formal composition is put together in order to tell you what you should eat and not eat. Occasionally, there are so many things that you shouldn't be eating right away that you'll wonder, well, what can you eat? We will give you a resource that includes websites, company names, and phone numbers to order the foods that you should now begin to eat. Immune shots can also be administered. These slowly make the body tolerant to the offending food. Foods are very complex substances. We will eat something, it is broken down by the digestive system and absorbed in the intestinal tract. Small molecular forms of the food then circulate in our bloodstream for a very long time, 4 or 5 days before they're eliminated. These offending agents and these molecules then go to the sensitive tissues. If you have sensitive skin, it will show up as a rash. If you have sensitive lungs, you get asthma. If you have a sensitive colon, colitis, etc. Sometimes the end organ isn't related to the offending food at all, and we don't put 2 and 2 together. If we were to put a piece of crab into our mouth and fall on the floor, it's easy to conclude that we may be allergic to that crab. If, however, the reaction is 5 days later, we don't remember. I don't particularly remember what I had for lunch 5 days ago. Do you? Testing has to be done that will tell us exactly what we're allergic to and what we're sensitive to. Again, The definition of the allergy is if IgE can be identified. These testing options are very well worked out today, and your diagnosis can be accurately made.